Good evening, everyone. Welcome to Your Health Matters OC. Tonight we have some very special guests from our HCA staff here to talk about hope for recovery from substance use disorders. We have Jenna Sarin, our Chief Nursing Officer, as well as Mark Lawrence, Division Manager of the HCA's Mental Health and Recovery Services, Children and Youth Prevention. And we have a very special guest too, Donald Keith, who is also with HCA Mental Health, and he's also a clinician working with the drug courts and the DUI court clinics. But of course, we'll start out with many of the different stats of what's going on in Orange County. Unfortunately, many of you probably have received a lot of alerts about the heat warning or heat advisory. We have an excessive heat advisory that will last to the end of the week. Tomorrow will be a lot hotter than today, so really want to make sure that everybody in the community prepares and reduces their outdoor exposure and maintains good hydration and stay in a cool area. And if you're like me, you probably also got an alert that you should minimize your use of electricity until 9 p.m. But we're really glad to have you tonight and talk about this very important talk. And the reason why we're talking about it is September is our National Recovery Month. So we're actually dedicating a lot of events throughout Orange County to talk about this important topic. And so for COVID updates, good news is our numbers are declining. We still do have a significant portion of cases in Orange County, so it's very important for everybody to get their vaccines. You can see there our case rate is still above 10. It's at 15.8, but it has decreased from last week. And the positivity has also decreased. Now remember, this data that we're showing you relies on data provided from people who actually get PCR testing. So everyone who's doing the home testing is not accounted for on these numbers. As far as vaccinations, we know that there's many different vaccines now available. And most recently, FDA, as well as CDC and the Western Scientific Workgroup, approved the newest bivalent COVID vaccine. So if you are eligible, meaning you are age 12 and above, and you have received your primary dose, you can actually get your booster. But please contact your provider for more information. And soon we'll have a slide that shows the different vaccines that are available here in Orange County. We also have Novavax for those who were not able to get the mRNA for whatever reason. And as you can see there with our vaccination rates, we are slowly getting more people vaccinated, including our younger ones, but we still have a lot of work to do. So as you see there, Novavax is one of the new vaccine platforms available to those who are not able to get the mRNA, but we also have the updated booster. Now I realize that our COVID numbers have gone down, but it's really important to consider getting the bivalent vaccine because this vaccine has the original strain as well as an Omicron variant that will help protect you in the upcoming weeks and months. We want everybody to have a really good holiday season, but that means protecting yourself against the variants that are circulating. So again, just remember, strong recommendation to still wear a mask, to still utilize all those preventive measures we've been talking about, and to get vaccinated, especially when you're eligible. In order to obtain a vaccine, I know that many of the computer systems will take time for them to actually have the bivalent vaccine show up as available when you register online. So please contact your healthcare provider or your local pharmacy to see if you can get the bivalent vaccine. We know it's already here in Orange County. It's just a matter of time for those electronic systems to catch up. And OCHCA will continue to focus on our equity areas and our high-risk groups, and also we'll be providing the bivalent vaccines at our OCHCA managed clinic sites. So welcome you to do that too. As far as monkeypox, current trend here in Orange County is more of a plateau. We still have a significant number of cases. You'll see shortly on your slide there. We actually had 172 cases as of today with 6 hospitalizations. For those individuals in our area that have high risk because they have known exposure, or they have had high exposure because of close contacts they have been with who also were positive, you can actually get the vaccine, Jynneos. You can log on to othina.com for more information or talk to your healthcare provider. If you do have monkeypox or you suspect you have monkeypox, please notify your clinician and get evaluated and treated, and please isolate because until you find out whether or not it's monkeypox, if you do have monkeypox, unfortunately, you could potentially be spreading it to those in your close household. What else about monkeypox? Do you have any other information, Jenna?
Highlights.
Those were the highlights, right? And again, we do have treatment here in Orange County. It's called TPOXX. So for those who have monkeypox, there is treatment available, which I think it's important to realize. As far as COVID, we also still have treatment, and the treatments still work against even the new variants. So we still have Paxlovid, Molnupiravir, as well as the injectable medication. So if you do end up with COVID, just like monkeypox, you need to isolate yourself and seek medical attention, especially if you have a high-risk condition, so that you can be considered for treatments. With that, we'll roll into our substance use disorder statistics here in Orange County, and I'll turn that over to Mark.
Thank you, Dr. CK, and thank you for mentioning that September is National Recovery Month. And one of the goals for us for Recovery Month is to educate the public and increase awareness about addiction, substance use disorders, and how those are impacting our community locally. So going to the first slide, we wanted to share some data about some of the impacts that are most concerning to us. The first slide shows the total number of annual deaths, suicide-related deaths, and the rates from 2010 through 2021. You can see that there's a steady increase year after year from 2010 through 2019. However, starting in 2020 and 2021, there's a sharp increase in substance use-related deaths. And we know that from 2019 to 20, there was a 32% increase, and then another 30% increase from 2020 to 21. And we know that a lot of this increase is because of opioid fentanyl, which we'll talk about in just a moment. So when we look at this data and we even look at it closer, we see that males have a rate twice as high as females when we break down the data by gender. And you can see from the chart that pre-pandemic, it was lower, and then after the pandemic hit, the rates for males actually increased significantly. So that's something that we're looking at and we want to be aware of. When we look at these increases in substance-related deaths, we see that in 2020 and 2021 that they have impacted most age groups, but specifically teenagers and young adults. So it's across the lifespan, it is impacting all different age groups, but especially our young. The next slide shows the deaths that are related to substances. And if you look at the next slide, the chart shows in red the alcohol deaths. And you can see that from 2010 through 2021, there's a steady increase. And then you can, when you look at the blue, that's drugs related deaths. You can see that it's steady, but you can see the big jump again is in 2020 and 2021. And then finally, the next slide just really further explains the substances that are related in these deaths. And keep in mind, there can be more than one substance related to a death, but we see that alcohol, stimulants, and opioids are really responsible for the highest number of increases of death. And then, which brings us to fentanyl, which is the next slide. We know that the primary reason for this large increase in deaths is because of illicit fentanyl that's become available in our community. Now, fentanyl is 100 times more potent than morphine and 50 times more potent than heroin. So it's very lethal. And what we're finding is that it's mixed in with other substances. It can be mixed in with heroin, with ecstasy, with cocaine, with meth. And so people who are using a substance may not know that there's fentanyl in what they're taking. So that makes them at increased risk. So for mental health, National Recovery Month, it has a deeper meaning because of these substances and a deeper sense of urgency that we make the public aware of these dangerous substances. And then if you go to the next slide, there is even a new development. There's rainbow fentanyl, which if you look at the picture of rainbow fentanyl, it looks like Fruit Loops. It looks like something that youth would be really attracted to, whether it looks like a candy or whether it looks like a chalk. So this is just something we're really concerned about. We want to make everyone aware of these new types of fentanyl that's coming out. And again, fentanyl is an opioid, and it is prescribed for medical uses, but the illicit fentanyl is particularly very dangerous and available. The good news is that we really are promoting Narcan and naloxone in the community as a life-saving intervention, and that can reverse an overdose. So we're right now, as Dr. CK will be mentioning a little later on, our Hope for Recovery events, we are educating the public about how to administer naloxone and actually distribute it. So we're doing a lot of great things for Recovery Month, and we wanted to share this information with you today.
Thank you so much for reviewing all those stats. So much wonderful information for our viewers to look at. And yes, it's so concerning that fentanyl now looks like a candy. I think my kids would look at that and want to probably even eat it and put it in their mouth because it's so beautiful, but or even touch it. And we know that even just touching it or even just eating a hint of it can really cause a death. So that's really concerning. And just remember, if you or anyone in your family is actually taking an opioid, please lock it away so that others won't get a hold of it. And also, please talk to your clinician or your local pharmacy to try to get Narcan. It's not because we expect you, or no one expects you to overdose on your own Schedule II narcotic medication. We know that people do have pain, and there's reasons why it's prescribed. However, in the wrong hands, usually it's the accidental ingestion of it that can cause an overdose. And if you have Narcan and learn how to use it, you can actually save a life. And again, Narcan is available at local pharmacies. If you have insurance, there's a potential for it to be covered. I do hear that it is expensive, and expensive meaning about $40 to $50. Narcan is easy to administer. It's just a squirt in the nose if you suspect that someone has an opioid overdose. And again, if it's an overdose or if they're unconscious, even if you sprayed it, it's no harm, no foul, even if it was not a narcotic. So we really want more in the community to learn more about Narcan. But many of our agency clinics already have it. Many of the law enforcement, paramedics, they already actually carry it. So it is available out in the community, but we also need it more in the hands of many more residents so they can also save their loved ones and other residents from this. Because we don't know sometimes when someone's actually overdosed from that. So thank you for sharing that very important information. So we're going to move on we're going to take a quick break and watch a video from SAMHSA to look at addiction as a disease and not a moral issue. Take a look at the next video.
The main thing that people need to understand in working with people in recovery is that addiction is a health issue, not a moral issue. It has nothing to do with a person's moral character. It is a health issue. It is a disease, and it needs to be treated as such. You know, so often addiction is treated like something that the person did bad. It's a bad thing they've done, and they need to clean up their act. And it's the only disease that a person gets punished for relapsing. For relapsing, you know, I'm a diabetic, and If I got go on for every time I ate a cookie, if they told me you're not going to get any insulin, Sterling, you ate a cookie, I'd be in trouble. And it's the same thing for people in recovery or people trying to get into recovery. There might be instances of relapse, but it's not the person. It's the person has an illness, and the illness is they have a desire for the substance, and it needs to be recognized as that. It's not the person. It's like when a person has cancer, you don't look at a person's cancer as something that the person did to get cancer, even though sometimes they might. They still get treated and they get all the services they need. And the same thing should be for those with behavioral health issues. An example: if someone goes into an emergency room who overdoses, the person is given whatever medication they need to revive themselves or be revived, and then they're discharged from the hospital. It's no other illness or situation that somebody just discharged without follow-up, without referral. It's simply a thing of, okay, you can go now, and it's a matter, it's a life and death issue, especially if someone's at the stage where they're overdosing, they need help, and they need help right away. But because of the stigma, it's like, well, that's okay. He'll be okay. He'll be all right. A lot of individuals with behavioral health issues end up in prison and in jails. The vast majority of individuals in prisons and in jails were under the influence of some kind of mood or mind-altering substance, or had the lack of the medication that was needed. But society sees that as, if they drank or they drugged or they didn't take their meds, they get the punishment they deserve. Nobody gets punished for any other disease. There's no such punishment for other diseases. So the stigma is a terrible, terrible stigma that most people, if they do not have or know someone who has recovered from these issues, simply do not understand. They simply do not understand. Again, thinking it's a moral issue when it is not.
Hi, welcome back to Your Health Matters OC. I hope you found that video helpful. For our viewers, thank you for joining us. We're talking about hope for recovery from substance use disorders. And if you have any questions, please email us at yourhealthmatters@ochca.com. That is yourhealthmatters@ochca.com. And we have here Mark Lawrence as well as Donald Keith, both who work with HCA, and wanted to hear more on your perspective after watching that video about just addiction, and addiction being a disease rather than a behavior trait.
Go ahead, Don.
Okay.
You begin.
I think that I know that when I myself came into the recovery world, I know that there were so many judgments, and there was so much guilt and so much shame already existing within my life that I wasn't in the mood to hear any more from any other people. I had already distanced myself from my entire family for 5 years, and I already felt badly enough about self that the stigma, the people assuming it's a moral failure, of mine or the way I was raised or any number, everybody wants to point the finger at a problem until that finger points at them, because that means that person, they hope, will take accountability. And that's really what recovery is taking accountability for our own life, owning where we've been, having the hope for where we can go. However people do recovery, recovery looks different for everyone. Some choose a spiritual path, some choose the gym, some choose 12-step support groups, some choose refuge recovery. Some just simply stop drinking and using. Again, it's equal opportunity recovery, and all you gotta be is a little more willing to be sober than you are tempted by the next drink or drug. And for those of us in recovery, it's not always rainbows and sunshine,
So tell us more about your background, because I know that you work for the drug courts and the DUI court clinics. But tell us about your experience, because I know that this has been a big part of your life in helping others. Because I know we gave you the title, we gave the viewers your title, but we didn't really give them the depth of who you are and how this has affected you.
Well, thank you. I appreciate that. It actually goes back further than simply just getting into recovery. I had worked for 6 years for the Orange County Probation Department, and that followed a brief career in the entertainment division at Disneyland, which is doing various costume characters in the park. And that's actually where I learned to drink and use, at the Tragic Kingdom. And I then made the next logical move and went into Orange County Probation Department. I loved my job. I loved working in juvenile hall. I got to do that for 6 years. And pretty soon, the drinking and drugging became much more important than reporting to work. And while I loved the clients I got to work with, I loved methamphetamine and vodka a whole lot more. I resigned from probation. I went on a 5-year run. 4 cars I lost, 4 homes I lost. I ended up living in a tent in a backyard, homeless. And finally, after a few arrests for possession, ending up in Orange County Jail with clients I had had on my caseload while they were in juvenile detention, sitting next to them on the bench, and having one of them absolutely said to me, "What the hell happened to you?" And he just walked away. That wasn't necessarily my bottom, because I got out of jail and promptly went and drank and used again, because I knew what would keep me from having to have any kind of feeling, and that was the behavior. I eventually ended up back in county jail. Shortly thereafter, I was offered the drug court program in 1999, November 3rd, 1999. I will never forget that day. I pled into the drug court program. I was placed on formal probation at the very same probation department where I used to work, with a probation officer whom I had trained at juvenile hall when we had worked there 5 years earlier. I began my recovery journey at that point. It has been wonderful. It has been awesome. It has been horrible. I'm still an addict. I know how to hide, but I don't choose to hide behind pills, powders, and potions anymore. I've been through death. I've been through some very rough times, but most importantly, I've had some pretty wonderful times too. I got to take care of my mom and my dad and my older sister. She was older by 10 years. And I got to take care of them as they passed away, and I got that gift. There was some abuse in my home, and by some I mean a lot. There were some rough times in my home, and that addiction to chaos in the home I grew up in is part of what was hard for me to leave behind when I decided to stop with the drugs and alcohol. I loved the chaos of the lifestyle, of living that, the adrenaline rush. And those things, thankfully, on the 25th of September, I will, and we're not supposed to get ahead of ourselves. I understand that. So if any of my people are watching, September 25 this year, I'll celebrate 23 years clean and sober. And I know it's only one day at a time. However, I've been granted a pretty beautiful life, and I will never not be grateful for drug court, because drug court saved me. Drug court offered me accountability, offered me structure, offered me the therapy I needed. Drug court offered me a therapist who told me, "You're not broken." I had no idea that that was true. I now get to work in the very same drug court, DUI court, that I graduated from years ago. And hopefully, on a daily basis, I get to offer my clients a little bit of hope, and hopefully teach them how to save their own lives, because we can't do it for them. Just as the parents and the loved ones of family members can't do it for them, no matter how badly we want to. But teaching someone how to save their own life has been one of the best gifts. I worked at a treatment center for 6 years before I came to the county. I've now been at the county for 10 years. And it's one way, and while I do get paid for this is my job, one of the tenets of recovery is the opportunity to give away what's been so freely given to you. And I get to do that outside of the walls of my job, my employment. It has to be the way I focus. Otherwise, all I'm doing is thinking about me. And don't you know what I think of me? And I'm self-centered. I will always be a man in recovery.
Thank you so much for sharing that story. You didn't have to, but I know that it does take a lot of courage to really share that. So thank you so much for doing that. I just wanted to talk about, like, I think I already kind of hear some of that almost self-blame. We want to really treat substance use disorders as a disease, right? I'm guessing that there's so much stigma attached to it. So people, I think that when you're starting to use, you start realizing you need to use more and more to get whatever feeling. But usually in that cycle, as you start to realize that, then the stigma starts to really set in. While you think you may need help, you may not want to because of the stigma that's associated with it. Can you tell us about that perspective?
Mark, have you anything to offer here? I kind of went off on my story, so maybe.
No, I think the video and what Don was sharing was that he already was experiencing a lot of shame, a lot of blame. And so that's not what he needed. And that's what not anyone struggling with recovery or an addiction needs. They need encouragement and support. And I think part of our messaging for National Recovery Month is that this is a treatable disease and that there's a lot of effective treatment that's available. So there's a lot of reason to hope. And we would want anyone to receive the treatment they need like any other condition. And really we need everyone to have that type of understanding. When someone starts to take drugs, their brain is basically taken over and they end up doing behaviors that are not good for them, that are harmful but feel healthy. And they build, as Dr. CK was saying, they build tolerance. And then this even diminishes their ability to even resist temptation even more. And it actually rewires their brain where they don't feel, they don't have joy from normal activities that would bring most people joy. So I think Don really explained that really nicely. And then just to add, Don, you said no one's recovery is the same. Everyone's journey is different. Absolutely. And that's what's important. And then part of that process is relapse often. And relapse is not necessarily a sign of failure. It may be a sign that someone needs more support or they need more treatment. And the hope is that they gain insight from that relapse, and maybe they address any triggers and what they can do to prevent future relapses. And then there's insight and there's transformational growth, and they become even stronger in their recovery. Do you relate to that? Does that?
I absolutely do, and I think there are so many people who come into recovery new, and you want and you want and you want just as quickly as you wanted whatever you wanted before. But all you had to do was stop by someone's house and wait there sitting on the front couch until you got what you needed. In recovery, we want the recovery, the effects, all of the good things we hear. We want that yesterday. You know, we're used to, everybody today is used to getting everything they want at the speed of internet, which means immediately, if not sooner. Now, having to watch clients as they struggle, and some of them do, and most of them do, because you cannot spend, say, 4 months clean and sober and think that you're going to take care of 14 years worth of addiction. That doesn't work. Use the scales for, and I try to do this with my clients and to say, they get frustrated, and initially what they think is, I want the house, I want this, and I want that, and my wife or my husband or my children, well, it's important for us to understand, and I will explain it to them, and anybody out there watching tonight, most of those folks, you had that husband or wife while you were drinking and using. It wasn't enough for you to stop. You lost the house, you lost whatever it is you lost. until you decide that you've got to do it for you, instead of saying, oh, I put this on the life of my child, or I'm doing it for them. It's nice because those certainly, your support system certainly are the people who benefit from your recovery, but you have to be the first one. You have to take care of yourself. You have to focus on yourself. We were talking earlier, self-care. It cannot be about anybody else but you. And to find that balance takes quite a while. Those of us brand new in recovery are not used to living life in balance. And balance is exactly what recovery is hopefully going to be based on.
Don, when someone's ready for recovery, they need a really supportive, encouraging social support, because recovery takes place in social connections and in communities. So everyone needs to understand it's a process. It takes time. Be patient, but we don't need any shame or blame. We need people to really support people and really help them access the treatment services and supports they need.
Absolutely true, Mark. In fact, so many of my clients and friends of mine in recovery are downright shocked. They continue to go to parties where everybody else drinks but them, and they don't tell anybody. They continue to do whatever it is they're doing because they're just too busy for all of those other recovery things. Well, you weren't too busy for the drinking and using and hanging out at the dope man's house until you got your sack. But you're now all of a sudden too busy those parts of recovery when it is building a social support system, telling people, having at least 2 or 3 people you truly care about and trust around you that you know you can say, look at them during the family barbecue. It's all great. If other people want to drink, that's fine. That's none of my business as a man in recovery. If I can look at my people and say, we need to go, then it needs to be okay. And not be shamed by friends and family and laughed at. Oh, I know you're not drinking now, but you'll get back to it. You hear so many terrible stories, and usually those are from people who are envious, probably, of someone else's recovery, or who are afraid of the idea of recovery themselves. And therefore, they will not empower or support or be there for their friend or loved one. And it is horrible. So much of the shame, the guilt, the laughing at, comes from those closest to, and sometimes in the same home as, the person who's trying to get better. Nobody else has to be sober just because they are. Okay? However, you continue to do your thing, but please, 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 continue to support and respect those that you love. If you truly do love them, you'll learn that you're going to love them whether they're sober or not, you know?
Thank you so much for sharing. We're going to take a little break because I know there was a lot to talk about there. I'm going to give you a little bit of break by watching the next video. I know there's still much more to talk about. Viewers, please watch the next video and to look at the journey as well as the need for support in community and family, just as you had spoke to about people who are in recovery.
My father was an alcoholic. It was just chaos all the time in our house because of his drinking. I didn't want to be my father, but I became my dad. I went from the alcohol to the drugs to the alcohol, back and forth, back and forth, back and forth, until it didn't really matter anymore what I was doing. I could be whoever you wanted me to be to get whatever I needed. And it got dark at the end, and so I drank and used, and I wanted to die every day. I remember it was July 24th, and it was 100 degrees outside. It was going to be a meeting, but there was a bar that I used to drink at, so I had to make a decision which one I was going to go to. And I went to the meeting, and that's where my journey began, was that day. I never diagnosed myself as being mentally ill. I was always taught, you know, come on, cut it out. Act like a man. Quit acting like that. But then I come to realize it's a disease. For years, I thought I could do this on my own. Get well, I couldn't. There's people out there that are willing to step up and to give you hope and to walk with you through this. I'm going to be the first to tell you that I'll ask for help today. I do have a whole fellowship of guys that, you know, if something happens, I know who I can call on. And they're always there. I talked to one this morning. I usually walk about 8 miles a day. It's just my way of just being able to be okay and be still within myself. I joined Atrium Health in 2010, and I became a peer support in 2016. Who would know better than a drug addict and an alcoholic to talk to another drug addict and another alcoholic? I can only give them my experience and what I've been through and share bits and pieces of my life. Say, you know what, I'll jump down in the hole with you, and we'll stop digging, but we'll be together through this as we climb out. I'm not who my diagnosis is, all right? I'm not, and I don't live that life anymore. I do not let that define who I am as far as with my addiction or anything else. I'm a person in long-term recovery. I'm a father, I'm a grandfather today. My grandchildren never see me drunk or high. What I have inside is the most important thing, and that's my recovery, my sobriety.
Welcome back to Your Health Matters OC. We're talking about hope for recovery for those who have substance use disorder because this month is National Recovery Month. So such an important topic. We have a very special guest here. I want to turn it over to Jenna to talk about, what her experiences have been here in HCA and just as, a resident. I'm sure there's many times you've seen family, friends, neighbors who have been going through this. What have you seen and what perspectives can you provide?
Sure. Thank you so much, Dr. CK, and certainly thank you so much for both being here and sharing so openly because I think it's incredibly important. I think that as a healthcare provider, we're very fortunate in this county to have some great resources, and I'd love to hear more about those. I think from a public health perspective, we have an incredible program that serves prenatal clients who may be struggling or have a history of substance use disorder to really assure that both mom and baby are in a safe place and space. And again, to be that person, as you spoke about, Dawn, with, care and compassion and concern and knowing how we can meet each individual needs. I think that's so important. In the health system, could we always be striving to be better? And, I think that I have some very close friends who actually have a child right now in recovery. And I think having been part and the privilege of being in their journey and understanding so much of what you've spoke about, just being, front and center, the stigma, people even, not wanting their children to be around or not having the same friend groups anymore because, gosh, then I'm affiliated with, right? And nobody ever says these things out loud, but people feel that. And so I think it's incredibly important. And one of the tools that I've seen HCA handing out in celebration of this month is the I love someone in recovery and you fill in the blank. And I picked up a handful of them. And I just thought this is such a great tool because we would say the same thing about someone that has diabetes or that has a neurocognitive disorder or other, any condition we can think of, right? So I just want to celebrate that. And I think it's so important. I really would love to hear more about some of the great resources that mental health and recovery have, because I know it has helped so many of our clients. And I think that's something really important that families need to know about. So if one of you could share more, I think that'd be great.
Sure. Thank you, Jenna.
Sure.
The healthcare agency has a wide variety of resources available depending on an individual's need. For example, we have outpatient treatment, and the outpatient treatment may be more intensive if that is the need of the individual. So before we start any treatment, we do a very detailed and comprehensive assessment. So besides outpatient treatment, we have residential treatment services for individuals who may need a little bit more support. And for both of those treatment programs, we have a lot of tools in our toolbox. For people with opioid use disorder, we have a medication-assisted treatment, which is really important. It can help people manage the withdrawal and the cravings and really get some really good time in recovery so they can be successful. We also have services for withdrawal management if people need help withdrawing off substances. And then we have resources like recovery residences if they need a sober living environment. So you don't have to remember all these resources. You can easily call or contact OC Links, or we have this great tool called OC Navigator, ocnavigator.org. And you can actually, through that app, you can connect directly to a OC Links Navigator, or you can self-explore some resources. And we have even a tab for substance use resources. So there's a lot of great resources available to the community. Don, did you want to mention anything else that I didn't mention, like 12, like recovery, like 12-step programs?
I think it is important to bring that up. And we call them support group meetings because there are so many different kinds. There's smart recovery. There is there's Buddhist recovery through refuge recovery. There is AA. There's NA. There are so many different programs out there. Something that is very frustrating for me has been to meet with a client, doing an evaluation on the client, having a client come in working on an NDOC, they're coming into the program, and they say, oh yeah, well I went there and I'm just, it's just not for me. Whichever one of those programs they're referring to. And I may say to them, well, how often did you go? I went twice and I just didn't like it. Really? For something that could possibly save your life, you sure as heck had enough effort to get to the dope man, and you went back to him after you got shorted and after you got a bad deal, but you sure as heck went back to him or found a new one. So it's so interesting that people want to come into recovery and not access what is open to them. Some people, again, as I said earlier, some people can do their recovery through the gym. Some people can do it through Celebrate Recovery, a wonderful, wonderful, wonderful spirituality-based program. There's all kinds of programs that are out there, and people just aren't willing to look for them sometimes. Some people are. I think it's important, too, and this is something we don't talk about a lot, but the family members of those who are in treatment also deserve a shout-out. Not only have they been through whatever it is they've been through, good and bad, usually bad, at least till the time that the person gets into recovery, usually it is noticed and it is said, oftentimes the codependent family members or loved ones are a little bit sicker than the addict. That may not be the case in your situation, but for those folks, I used to run a family group at the treatment center I worked at. And I would say, if this happens and you have an intervention and you have to say, here's a boundary, you're out the door. I'll see you when you have 30 days clean and sober, after you've exhausted a number of other options and choices, because you got to always offer the addict, the person in recovery, offer them choices. But if those haven't worked, and my parents would raise their hand and say, I could never kick my loved one out of the house. Well, I'll tell you what, as an addict myself, if all I had to do was put up with a few minutes of griping and complaining from my parents or loved one or husband or wife, daily or weekly, and I still had food in my belly, I still had a roof over my head, what's my motivation to stop? And why are you so shocked when I don't? Because you sometimes continue to allow it. Now, that's a whole other telecast, and maybe we'll talk about that in the future. But the families of those in recovery could absolutely use, if they choose to, Codependence Anonymous, Al-Anon, books by Melanie Beattie, things like that. There's a great shop called The Latest Thing in Costa Mesa. For the family and for anybody in recovery, they have literature and they have anything you might need from whichever direction you're coming, as long as you're coming towards recovery. Let me also say, it's unfortunate, I just lost a friend this morning, and it breaks my heart. And yet I know that the family did everything that they could. I can't imagine what they're feeling like right now, and I'm not going to pretend to. However, those of us who continue to drink and use or be in and out of the program and relapse and over and over and over again, isn't that just reflective of the selfishness of addiction? You know, it's a shame now that my friend is gone because there are other family members who are going to have to move on. It just so happens that I'm grateful, and I'll wrap this up because I realize I get real talky, offering people hope, lending people my hope. Mark was one of the clinicians in the original drug court clinic that I went through in 1999, along with some others who now, you know, work here at the healthcare agency. And what they did is they extended me a lifeline of their hope. They lent me their hope. And that's what I get to do with clients now. And I get to remind my clients, and I'm a dork for doing it, and I'm okay with it, what HOPE stands for, H-O-P-E, happy our programs exist, because there is a little bit of hope and sunshine in each one of these programs, depending on who you are and where you come from. Please check out OC Links, just as Mark said, or any of the upcoming activities we have for Recovery Month. There's a lot going on.
Thank you so much for giving us all that insight. And actually, we do have a little bit more time. And because you had mentioned the importance of the community as well as the family, if we have time, I'd like to actually show the viewers the show or the other video that talks about the importance of the family support, because I think families need to hear that. So shortly, viewers, you're going to see a video come up about family and the support.
He drank for years, and it nearly ruined our marriage. We were on the brink of divorce, and he finally got sober. Those early days were so hard.
I didn't know how to help my daughter when she was in college. She got into trouble at school and even got suspended. She worked on herself, but I had to make some changes too.
My family was basically done with me. I drove them away for 15 years when I was drinking. When I got sober, I had to ask them for help, and that wasn't easy.
I had to take opioids after my back surgery, but I kept taking them, and I ended up with a huge problem. My husband was frustrated, and I didn't know how to explain it to him.
These are the voices of people recovering from a substance use disorder, and the people closest to them. Treating a substance problem and maintaining recovery are challenging for anyone. The journey from initial use to problematic use often changes people's relationships. Acute medical care, short-term abstinence, and maintaining long-term changes are all important parts of a person's treatment and recovery, and friends and family are often involved. Here are some of the best ways to support someone in recovery. Understand substance use. Know about problem use, tolerance, dependence, withdrawal symptoms, and cravings. Each of these has a powerful effect on the person who is struggling with a substance, and each affects how that person thinks, feels, and interacts with others. Be patient. Treatment for substance use disorder does not end when the person stops using. That's usually just the beginning. Starting treatment can be difficult. People are making major physical and behavioral changes. The more patience you can offer, the more they can focus on the challenges of treatment and meaningful change. Honor a person's choice in treatment. There are many ways to stop using a substance, including hospital-based programs, residential facilities, professional counseling, and self-directed and community-focused 12-step peer groups. Friends and family members may not always understand or agree with all treatment options, but a person's own choice for his or her treatment typically gives that person the best odds for long-term success. Be a part of their support network. People with strong support networks experience a greater chance for meaningful change. Friends and family may experience some of the same challenges as the person in treatment, but a strong support network is essential when treatment gets hard. Maintain your boundaries. Be supportive and offer reasonable, practical help. It's also important to remember that your loved one's treatment and recovery is his or her responsibility. It's not possible to recover for someone else. It also doesn't help to punish or reject someone when he or she struggles. Grow your own support network. Just as your loved ones need support because of the challenges experienced in treatment and recovery, friends and family also benefit from support. It can be really helpful for you to connect with other people in your situation to get support during this challenging time. Relationships will change. Treatment and recovery from a substance use disorder will affect almost all aspects of a person's life, including relationships. These changes are often unpredictable and can be challenging, but change is inevitable. Recovery may be a lifelong journey. While some people are able to address a problem with substance use quickly and effectively, and can even return to some form of controlled or moderated use, many find that lifelong abstinence is needed. Supporting another person's treatment and recovery can be a challenging time in any relationship. Substance use is a common problem, and there are many effective treatments available for people who want help. Friends and family members are often affected by someone else's use and decision to seek treatment. Taking the time to learn how to help might be the most important thing you can do for a person you care about.
Welcome back to Your Health Matters OC. We're talking about Hope for Recovery, and we just had a wonderful show and discussion about treatment options, reducing the stigma, and I really want the viewers to know that there's more that you can do to help with this and to celebrate this month, and just make sure your family, your friends, your neighbors are more aware of this. One, by wearing purple. We're all wearing purple ribbons here. Purple, and apparently turquoise and purple are the different colors for the month, but purple was the official. And I encourage you to really work on sharing the stories of recovery, just to increase awareness and show others that recovery is possible, and also to just support those in recovery. They need to hear that you're there and you're supportive and you're not, to help reduce the stigma and just uplift those who are in recovery, because it's a tough journey. And treatment does work. There's many different treatments available depending on which type of substance one is abusing or using. But that does require the individual to want to get treatment. Also learn of the different signs of substance use disorders to support those who are seeking help. So if you're starting to see a coworker or a friend or a family member who is starting to show those signs of symptoms of being on a substance, or they're starting to not take care of their duties, maybe they're shying away from certain activities because of their use, that's when it's really important for families and support groups and friends to really come aboard and offer help and show them that you do love them and that you're not there to stigmatize, right? You're not there to criticize, but to offer help. And again, reduce the stigma and shame by surrounding this everyone who has substance use disorder. Good news here in Orange County, we have so many events that are occurring to support this Hope for Recovery. On September 7th, Fullerton Public Library will hold an event from 6 to 7:30. And then on September 14th, San Juan Hills High School will hold an event from 5 to 6:30 p.m. So if you're interested in those events, please talk to your local cities or the school or the library. And you can also follow us on Facebook for more updates through September. Mark, did you have anything else to add on regarding other events?
No, that's great. And then at these events, we're going to be sharing some of the same information that we shared tonight. We're going to highlight a story of someone's journey in recovery. We're going to provide you with accurate information about substance use disorders and addictions, and train people how to administer the life-saving intervention naloxone, and actually you'll have a chance to receive naloxone. And we just want to say that these events are co-hosted with our Board of Supervisors, and we're so grateful for them elevating this conversation and bringing this to our communities. So thank you, Dr.
Great,
CK.
thank you. Thank you for also bringing up the topic of Narcan. I think that's a hot commodity, because if you can get it for free and also be supported by a lot of individuals who can talk about this and how to appropriately use it, I mean, I'd sign up to even just go for that. Our next show will be September 20th, so please join us in 2 weeks. We're going to talk about suicide prevention, because September is also the month for suicide prevention. We'll be addressing the topic of different options, what suicide is about, how to support someone who is potentially actively suicidal. I think it's a very important topic, because unfortunately there's a lot of suicides that are happening, especially with everything that's been going on. So please tune in. We really thank you for joining us this evening to talk about hope with recovery. Thank you.